We're the only species on the planet, aside from our domesticated pets, that get dental decay. We just get cavities, or my gums just bleed. This is not normal. We need a major mindset shift. 250,000 children undergo general anesthesia a year in the United States for dental decay. First 1,000 days, it's the first 3 years of life, are profoundly impactful for a child's health trajectory for the rest of their life. I was very dissatisfied with my career because I felt like I wasn't having the opportunity to really dig in deep with my patients to actually take a preventative approach. I wasn't able to achieve that with the traditional dental model. Functional dentistry should be thought of as part of functional medicine. That means the dentist needs to be trained in functional medicine. We really need more dental physicians, and this is where the oral microbiome comes in. Everything you put in your mouth is influencing your microbiome. The mouth is the gut.
Hey everyone, today's episode is a cannot miss episode with Dr. Staci Whitman. Dr. Staci is a board certified pediatric dentist, but she's been practicing holistic and functional dentistry. You may have seen her videos online talking about airway health, the oral microbiome. She is a wealth of knowledge. We dive into so much and primarily focus on why the oral microbiome matters, how you can be choosing the right products, toothpaste, avoiding mouthwash, discuss fluoride, and of course, diet, and how all of these things impact not only your teeth and the health of your mouth, but your whole body, your brain health, cortisol levels, sleep, stress, on and on. So you don't want to miss this. This is a great episode. I learned so much, and I know that you will as well. Enjoy. Hey, everybody. So excited for this episode today of the Gut Check podcast. I have Dr. Staci Whitman with me, who I've been wanting to interview for a long time and following her work for a very long time. And so we're going to dive into all things oral microbiome, oral health. Dr. Staci, thank you so much for being with us.
Thank you for inviting me onto the Gut Check. I'm excited to be here, and I want to first just say that the mouth is the gut. So We'll dig into that, but I want everyone to start thinking of it that way and not thinking of oral health as an afterthought. Like, it really is front and center. And so I appreciate this opportunity to amplify that message.
Absolutely. Well, let's start with your background. Just give everyone a taste of your background and the wonderful practice that you are leading today.
Well, I was trained traditionally, as every provider has to be. And I practiced general dentistry for many years. I was very dissatisfied with my career because I felt like I was constantly putting out fires and I wasn't having the opportunity to really dig in deep with my patients to actually take a preventative approach. And I believe everyone goes into healthcare to help and to help prevent chronic illness and to really support our fellow humans to thrive and to optimize. But I wasn't able to achieve that with the traditional dental model simply because we don't have time to really get to the root causes and really understand a patient. And truly, also, I just wasn't educated in how everything's connected. Dental school, in my opinion, is too short. I think it needs to be much longer. I think it should be part of the medical school curriculum, to be honest with you, and a subspecialty of medicine. We'll see if we ever get there. So anyway, I almost left dentistry. I really did. I almost abandoned my career, but I thought, my gosh, I have so much debt, student loan debt, that would be irresponsible. So how do I salvage this? And I said, how do I get as upstream as possible? And that's with children and education. I thought, I'm going to go back to get my board certification in pediatrics. And I do love children, but that is not why I went into pediatrics. I truly went in to get upstream. Okay.
Yeah.
And then, so I graduated from that program, became board certified, and found myself in the same situation with this turn and burn practice style, except with pediatrics, it's even faster. And if anyone has brought their child to the pediatrician or to a pediatric dentist, it is very fast. You're seeing so many patients, and I had even less time. So during this time period, I myself Was also trying to live a more holistic lifestyle. I've always been into healthy nutrition and just how human biology in general and how to really, really optimize it for a long, healthy lifespan. And so I thought I need to do this differently. I need to
Yeah.
recreate this model. And so I found myself diving in to research and books and attending naturopathic conferences and functional
Mm.
medicine training and et cetera. And so it's been a long journey, but an amazing journey. And I would say over the past 10 years, and I'm still working on this, I've just created a very unique practice model where I
Mm.
practice functional dentistry, and specifically functional pediatric dentistry, that's focused on airway health. But I do
Mm.
speak to, because of my history with the adult population and all the
Yeah.
research and education I do, I speak to all ages, and all procedures about functional dentistry. And functional dentistries, like functional medicine, where we look for root causes, we connect the
Mhm.
dots, we want to understand truly what happened in that patient's history to get them to where they are now, and how do we slowly unpack that, unravel that, and get them back onto a road to health.
That's awesome. And it's so cool. I mean, on this show alone, for someone who has just for the first time heard that word functional
Mhm.
dentistry, right, which is still kind of a novel concept, you hit on this. You're looking for the root cause. But what
Mhm.
are some of the core differences? If you were to list two, three, four differences of a functional dentistry practice versus a traditional dentistry practice, what are some of the core differences that you'd find with a functional dentist?
So, functional dentistry should be thought of as part of functional medicine. And in my opinion, that means the dentist needs to be trained in functional medicine. And
Hmm.
that's what I believe dentists are missing. We're missing the medicine part. We're missing what our physician colleagues, the education that they went through. So the
Yeah.
hormone pathways, the gut
Hmm.
health, like, let's learn about gut mapping and how to run these tests and diagnose them and interpret them. And then what strategies do we implement? Immune health, cardiometabolic health, bioenergetics. Um,
Hmm.
we barely get medical training in dental school because we're so focused on clinical training, like
Right.
fixing teeth. We're like little mini surgeons, but we
Right.
miss this huge component about how tied in oral health is to the rest of the body. So
Yeah.
I strongly believe a proper functional dentist needs functional medicine training.
Hmm.
And there aren't many out there yet doing that, but we're trying to change that. So I have co-founded the Institute for Functional Dentistry, and
Cool.
we're allied partners with the Institute for Functional Medicine, which that launched in the 1990s. It was Dr. Jeffrey Bland's beautiful vision. He was the one that really coined functional medicine.
Hmm.
And so he's such a wonderful thought leader. And then, of course, many people have heard of Dr. Mark Hyman. And
Hmm.
so we're following in with the Institute for Functional Medicine as allied partners, where dentists can go and they get their functional medicine training,
Yeah.
and then they get functional dental training where they can
Very
get the
cool.
subspecialties. So specifics to nutrition and oral health, or pediatric dentistry, or
Yeah.
endodontics, root canals, or oral surgery, implants, orthodontics, airway, all the things we did in dental school. Literally, it's a residency level program, but through a functional medicine lens. And they have
Yeah.
to take that functional medicine training first. And I do have my certification through IFM. I'm one of the only
Mhm.
dentists in the world who went through that. And I'm going to be very honest, it was the hardest
Yeah.
curriculum and tests I have taken, because we just aren't exposed to this level of medicine in dental school. So
Mhm.
I think we're at the forefront of this big shift, and many of us. I want to make sure I'm clear. I'm not. There's many of us out here pushing for this.
Yeah.
I'm one of an army,
Yeah.
and but we need to get the mouth back into the body. And while
Yep.
it's really important that there are dentists out there that are more technicians, I would say, or surgeons, because we do need to fix teeth, we
Yep.
really need more dental physicians. And this is where the oral microbiome
Mhm.
comes in. So when you said
Yeah.
what are some things that are different, we focus on root cause, and we know so much of that has to do with the oral microbiome
That's
and
right.
the gut microbiome. Okay. So
Yeah.
let's just say the microbiome,
Yep.
as well as nutritional deficiencies and gene SNPs and airway health,
Hmm.
hormonal imbalances,
Hmm.
cortisol imbalances impact salivary health. Salivary health impacts dental health. Like, it's all connected. Okay. And we can dig into what seems appropriate, but it's really looking deeper, and it's looking more at the human as a bio individual. So dentistry really does tend to treat everyone the same. And we need to start creating more personalized medicine, including with our oral health. So that's a quick synopsis, but the program launches in January. So I'm very confident in a year or two there
Yep.
will be so many more dentists out there practicing this way. I think it's going to happen very quickly. And then there will be a database where patients can go and find a dentist near them that's thinking and practicing this way, but with the proper certification as well, which is important. We need some standardization. That's how we move forward, and that's how we're taken seriously by other colleagues too.
Functional dentists are really hard to find. They really are. I mean, I was doing some searching before
Yes.
this, and it was like, man, I mean, where do you even start to go and how do you look for them? When you're talking about getting as upstream as possible, things like, airway health, what are some of the things that you're looking for in children specifically, as a functional dentist, that a traditional dentist wouldn't be looking for in children?
Well, not to overwhelm,
Yeah.
but the where it really starts is preconception.
Yep.
So not all of us have that luxury of pre-planning some things in life, but
Mhm.
making sure the terrain is optimized before we conceive is ideal, and that includes one's gut microbiome and oral microbiome and vaginal microbiome, etc. And this is for both partners. Taking care of any dysbiosis in the mouth or the gut, because your baby receives information from you, and we know now too they receive the microbiome in utero from the mother
Yep.
to some degree.
Yep.
We didn't realize that until fairly recently. And then certainly how you give birth impacts
Yep.
things. What are the medical interventions? And I'm not advocating for anything here. I'm just saying, is your child put on antibiotics? Are there a lot of
Yep.
outside environmental factors that are influencing them? Were they premature? Were they in the NICU or the PICU? Are they breastfed? What's the health of the caregivers around them? Because we know as tribes we exchange our microbiomes.
Yep.
So that's how upstream I get in my practice. And my patients tease me because my intake form is like a novel, and it takes them
Yeah.
a long time to fill out. But then after they kind of hem and haw about it, I think they see how it's different, the
Mhm.
things I'm asking them. And it's also important, what are the environmental toxins and exposures of the parents and the baby?
Yeah.
And that isn't just heavy metals, it's also mycotoxins. What's the nutritional status of the mother while she was pregnant? Was she vitamin D deficient? Was she mineral deficient? What was her stress level? Did she have a lot of stress? Did she have airway issues? Does she
Yeah.
have sleep apnea? So that's so important, because it does set the
Yeah.
child up on this trajectory. But then, of course, we start in infancy, and we look at how the baby is feeding,
Mhm.
how they're sleeping, their posture. Do they have torticollis?
Yeah.
We work a lot collaboratively with craniosacral therapists, osteopaths, chiropractors, because that's neurosensory integration, which is all very important too, for how we breathe and how we swallow and how we chew, and of course, just our general mood and behavior as we age. Food introduction is so important. Was the child breastfed? How are they breathing? Are they mouth breathing? Are they nasal breathing? Do they snore? Um, what foods are introduced to the child? Are they on a whole food diet mostly, or have we shifted to now the standard American diet, the ultra processed foods, the goldfish crackers, the chips, the pretzels, the granola bars, the gummy fruit snacks? This all influences. So you'll hear people say the first 1,000 days, it's the
Yep.
first 3 years of life,
Yep.
are profoundly impactful for a child's health trajectory for the rest of their life. And again, I like to share this education not to overwhelm, because if you
Yeah.
have a 7 or 8 year old and you're looking back, I don't want any parent or specifically mom guilt, but this is important to share so that we can, when you know better, we can do better for future generations too. So those first 3 years of life are really powerful for the microbiome.
I'm so glad you brought that up. That's an area of research I personally have just been fascinated with for years. And then obviously bringing it into gut microbiome health. But the first 1,000 days of life, for anyone who's maybe hearing this concept for the first time, is the most profound window of opportunity that we have to impact human health. So a couple of other just practical questions for more from a parenting perspective. When should children start seeing a dentist, ideally?
Yeah. So I think it's important to know too that cavities and gum
Hmm.
disease are the top chronic diseases globally in children and
Wow.
adults. Many people don't
Wow.
realize that because, again, people tend not to take these things seriously. We have
Yeah.
normalized these things.
Yeah.
We just get cavities. My family just gets cavities, or my gums just bleed. This is
Yeah.
not normal. Common isn't normal. We need a major mindset shift. Humans should not be getting cavities. We're the only species
Wow.
on the planet, aside from our domesticated pets, that get dental decay. So when you look 10 or 12,000 years ago, which was a blip in time,
Yep.
ancestral humans really did not get decay. Maybe here and there in certain tribes where there was maybe high fruit content or there was a lot of honey, but
Yep.
generally we were pretty cavity free. And if you go to the Natural History Museum or just pop online and look at the dentition of our ancestors, they didn't have fillings and crowns. I mean, they weren't
Yeah.
dentists. Um, so what has shifted, it's our diet. It was the agricultural revolution, the industrial revolution. So this is important to talk about because these things aren't normal. And so again, this
Right.
isn't to make you worry or be shamed, but if we can educate you early, we can avoid these issues in your children. Okay. And so um I can't get an exact stat, but the closest I can find is about 250,000 children undergo general anesthesia a year in the United States for dental decay.
Jeez.
That's a preventable disease, and that is a statistic I find overwhelming, but it's something we're just not talking about again because we've normalized it. So most dentists will say, or most pediatric dentists, based on our guidelines, will say they like to see children by the age of 1. So around the
Okay.
age of 1, their first year. I do like to see babies because I'm looking for oral motor function
Yeah.
issues. Do they have a tongue tie, a lip tie?
Yeah.
Do they have that torticollis or that imbalance or oral posturing issues? But also, it's an opportunity to talk about the importance of oral hygiene early. As soon as a
Yeah.
tooth erupts, it can get a cavity. So at 6 months old, your child could get a
Wow.
cavity. So we do need some sort of oral hygiene routine. But even more importantly, it's really educating on food introduction
Yeah.
and whole foods and introducing fermented foods
Hmm.
and flavors. I think so many parents are so fearful that their kids won't like things, but using like curries and garlic and cinnamon and these things that really help develop the palate
Yeah.
instead of leaning on this packaged
Yeah.
crackers and chips and cookies and the things that we in modern busy exhausted parenting lifestyle that we lean on, but just giving parents to empower them to get back to things from farms and from the earth and less
Mhm.
things from factories, particularly in those first 1,000 days. It's so, so, so important. And we're so bombarded with sugar.
Yeah.
And that's why, really under 2, the guideline is 0 added sugar is the recommendation. Well, why is that? It's for palate development. It's for, and I mean literally like how they're tasting, their taste
Mhm.
preference, but also their microbiome. And
Mhm.
we see a lot of candida and yeast in kids. This is a
Mhm.
big component to cavities. People don't speak enough about this, but when I see rampant decay in young children, I
Yeah.
immediately think yeast.
Yeah.
Um, and snacking frequency, we eat too much. And, as a gut health specialist, you know how important it is to
Yeah.
give your gut a rest,
Yep.
to allow that migrating motor complex to clean and rest and digest, right? But we don't. We eat and we sip and we snack and we get the Frappuccino and we eat the crackers and the Doritos, and we're just imbalancing ourselves to a degree where we're creating disease. And so I would say that was a long-winded answer, but
Yeah.
I really want to see kids around the age of 1. And
Yep.
parents will always say, oh my gosh, well, my child won't sit. Don't worry about it. Go see a
Yeah.
pediatric dentist. We got you. We have all
Yeah.
these strategies. We lay the child back in our arms, in our lap. It's very quick. They may not love me looking in their mouth. It's so fast, but you're
Yeah.
mostly there for education. That is why you're going. You're going there to learn about dental health and optimization. We talk a lot about vitamin D3 and
Mm-hmm.
K2 deficiency, and how I want kids on magnesium blends because we're so
Mm-hmm.
deficient in magnesium and minerals. That can impact sleep and sleep quality and how we breathe, but also our teeth and our bone development and our skeletal development. So it's quite layered.
Yeah.
But the earlier is the better. And so if your child's 3 and you still haven't seen the dentist, don't panic, but
Yeah.
call after you listen to this episode and
Yep.
just set up an appointment, because the sooner the better. And if we catch things early, we can reverse and arrest decay. Sometimes you can heal cavities if they're caught early, or it's called demineralization or incipient
Mm-hmm.
lesions. There's a lot we can do to course correct. Or if we see that a child's airway is not optimized, there are strategies that we can do to help get them back on track, or at least refer you to the appropriate sources early,
Yeah.
so that you don't end up like I was as an adult dentist, seeing these patients who were truly just a mess. And
Yeah.
it's so hard to unpack all the layers after decades and decades of this imbalance and dysbiosis, essentially. So
I want to go back to something really quickly because I think this is really important culturally. And obviously, there's probably some incentive structure behind this, but why have we normalized cavities? It's
yeah.
completely normal. And you're saying we're the only mammals that get cavities. Why has this
hmm
become so normal within dentistry?
I mean, I can tell you why it's normal in our species is because of our
Yeah,
food.
right.
And dentistry was created as a byproduct of the issue, right?
Mhm.
So I think why dentists aren't speaking about this more, having been there, is the disease is so overwhelming
Right.
that you can't even jump off the hamster wheel to have a moment to think about,
Mm.
my gosh, why is this happening? And what I'm doing really isn't helping. I'm just patching the dam.
Mhm.
I'm just putting band-aids on things all day. So um I think it's just societal. I mean, it's just been a
Yeah.
slow roll that cavities became um a major issue, I'd say, after the Industrial Revolution, and then
Mm.
really after the world wars, where there just became suddenly, after having not much, there became like a surplus of
Mm.
sugar. And then of course in the 40s and the 50s, the processed food explosion, the
Mhm.
TV dinner, and now look at where we are, the 80s, the 90s. I mean, everything is processed. And the other thing people don't speak enough about is all these preservatives and food dyes and flavorings. And I'm not going to get into the arguments about are they quote unquote good or bad, but I say, well, but what are they doing to the microbiome?
Right.
Okay, anything you put in your mouth is impacting your and shifting your oral microbiome. It's just like anything on your fork is information feeding your cells, influence your mitochondria. Is it going to be a positive influence or a negative influence? It's the same with your microbiome.
Mhm.
And we haven't studied this enough. I mean, I
Mhm.
think logic would tell you a bunch of red food dye with artificial flavoring and things that are dropping the pH of that food so they're acidic
Mhm.
is not optimal for your oral and gut microbiome.
Yeah.
But yeah, I can't tell you why exactly we've normalized it, but I'm asking everyone to work towards stopping that, help me spread this
Yeah.
message. Um, And my dream is to have a cavity-free world. Of
Yeah.
course, that will never
Yeah.
be 100%. My point is, I'd like to see caries or cavities no longer the top disease in the world. It is a preventable disease. And so we need to make efforts to try to educate
Yeah.
on that, because it's going to come from the patients. I think it really
Yeah.
is. It's going to come from people that are sick and tired of it. They're sick of dental insurance. They don't want their kids to sit through these dental procedures. They're not fun. They do create emotional trauma. I mean, fear of the dentist is a real thing. That's
Yeah.
another reason why I went into pediatrics, is I honestly couldn't handle the hate. I mean,
Mhm.
I would walk into a room, and you have to remember, at that time I was like 26 years old. I'll like try to be bright-eyed and bushy-tailed, and there would just be people like gripping the armchair
Oh
rest and
gosh.
just saying, I hate you. I don't want to be here. I hate you, doc. And seriously fearful. And it's really hard. It's emotionally
Yeah.
taxing.
Yeah.
Um, when you haven't even met that person or touched them or had any experience with them. So it's a real thing. And so imagine if you just went in every 6 months or a year to just get a quick cleaning and a checkup and an oral microbiome test. Imagine
Yeah.
that was your dental experience. It would just be, we no longer be the brunt of the joke. And in movies and songs is like, everyone's afraid of the dentist.
I would love to hear from your perspective how you describe how the oral microbiome is so important and why it's so important, and how it is the first entry point to so many other systems in the body, like the gut and the brain, hormones, all of these other important systems that we have heard, frankly, a lot more about at this point.
Like everywhere in your body, you have good bacteria and you have bad bacteria. And we hope that we always have more beneficial or commensal or healthy bacteria and species than we do pathogenic. And this is our terrain. And so, how are we in balance? So, in your mouth, you do have a medley, if you will, a rainforest effect of different bacteria um, in this beautiful ecosystem. And you have different bacteria on your tongue than you do on your teeth, than you do down in the gums, than you do in your tonsils. There's different niches.
Mhm.
And they all work together and they all communicate together. And we are still learning so much about this, which is really exciting. For whatever reason, there is an imbalance in the host and pathogens take over. This is dysbiosis. And this is where you start to see gum disease, periodontal disease, cavities, tonsil stones, chronic halitosis or bad breath. And so that's a red flag right there. Okay, if you can say, like, how do I know if my microbiome's healthy? Do you have cavities? Do your gums bleed when you brush and floss? Do you have chronic bad breath? Are you always grabbing mouthwash or mints? We can get into that.
Yeah.
Do you have tonsil stones? So you have dysbiosis. And you can do oral microbiome testing now. There's direct to consumer tests. You spit, you mail it out. In 2 weeks, you have your results. Now, the problem is, what do I do with these results? Who do I
Yeah.
go see? We are working on that. Although many of these testing agencies now have beautiful platforms where they do give
Right.
you protocols and strategies. So, um, I want everyone to remember that you swallow 2,000 times a day. Okay. So your saliva, we're going to start really respecting our saliva and almost worshiping it. Your saliva is incredibly important. Your spit is so influential over your health. It keeps your teeth hydrated, it exchanges minerals and ions. It's where we do make and break down our food, that we have digestive enzymes. We create nitric oxide in the mouth too, based on bacteria that are in the mouth. So a lot happens in the mouth, and it definitely influences the gut. But also now we have learned that the oral microbiome influences every system in the
Mhm.
body. And so there are very specific keystone pathogens or bad bacteria that are being linked. So, not necessarily causal yet, although some studies are showing causal, but certainly correlated with things like Alzheimer's and dementia,
Yeah.
or pancreatic and colon cancer, or fertility issues, or pregnancy outcome challenges like miscarriages, autoimmune diseases, rheumatoid arthritis. mood disorders, depression. Think about like the serotonin that's created, the neurotransmitters that are created in the gut. So how is the oral microbiome influencing that? People might say, well, how does the oral microbiome influence my brain health? Well, these pathogenic bacteria, they release endotoxins, exotoxins, and those are inflammatory. Basically, it's inflammation. Okay, they create inflammation in the body, but also they can travel from the mouth through different nerves that cannot come up to the brain, different parts of the body, and end up in places they shouldn't be. And then that creates an immune response or a cytokine storm, essentially. Um, and so we, especially gum disease and periodontal disease, those pathogens associated with that are very much linked to pretty negative outcomes in the body. And so we know a lot. So much is about oxidative stress, and so much is about inflammation. Okay. And so, what is inflammation in your mouth? Again, gum health. Your gums are so important. It's why I want people flossing. I want people water picking. I want people taking this seriously, but also nutrition. I mean, vitamin
Yeah.
C deficiency, think of scurvy. Your
Yeah.
gums won't be healthy. Or if you are B vitamin deficient or zinc deficient. And then nitric oxide, too. It's incredibly important for cardiovascular health. So, this is another issue, is the bacteria in our mouth can influence our heart health. And some people have experienced this. If you've ever had a heart surgery, you perhaps need to take antibiotics for X amount of time based on your cardiologist and your cardiac surgeon's recommendations before you go in for a dental cleaning. Well,
Yeah.
why is that? We don't want the bacteria in your mouth to go and land on that valve you just had replaced or that stent you had put in and create an issue. We really need a lot of surgeons now require that the mouth gets cleaned up and the infection gets eliminated and we get a more balanced microbiome before you go in for certain surgeries,
Mm.
knee replacements, cardiac surgery, or if someone has cancer. We really want to make sure we're cleaning up the mouth so there's no areas of possible infection. And there is so much hidden infection in the mouth. And unfortunately, a lot of it was created from dentists. So
Yeah.
just bad dentistry,
Yeah.
and it will take us a while to course correct, but I'm confident we can get there. I really am.
One of the positive things I would highlight is that we are seeing culture and society be receptive to functional
Yes.
medicine and to these course corrections because it's gotten so bad that
Yeah.
this can't continue, right? So
It can't continue. It's not sustainable. Mm-mm.
most people think of oral health as I want white teeth or pretty white teeth. I don't want my breath to smell bad. And ideally, I don't want any pain, root canals, cavities. So I don't, I can avoid the dentist. Why are most of these practices putting on Crest white strips, chugging mouthwash every day,
Mhm.
using the wrong toothpaste? Why are these practices actually working against us and causing
Mhm.
more of a problem?
We'll go back to the concept that everything you put in your mouth is influencing your microbiome. Okay. So, a lot of these whitening agents are pretty caustic, they're acidic, they're for sure shifting the microbiome. They can actually damage and influence your enamel health, they can thin the enamel, they can cause sensitivity. And so I'm not saying never to brighten and whiten your teeth. We have to find balance, right? I mean,
Mhm.
people are always going to want straight white teeth. I think that's
Mhm.
wonderful, but we also need to be realistic with expectations. And unfortunately, we are flooded with filters and edited videos
Mhm.
and just unrealistic images that are photoshopped. So
Mhm.
realistic expectations. The veneer movement, I hope, is a phase that will go away soon. I'm not saying never have these type of
Yeah.
aesthetic treatments, but it's really been overblown.
Yeah.
Because again, any filling, any crown, even a veneer, it's never going to be exactly like your real tooth. So there always
Right.
will be a margin or a ledge, and that now is an area where bacteria can hang
Yeah.
out and cause problems. So that's bleaching, mouthwash, the same thing. There's alcohols, there's astringents.
Mhm.
Particularly traditional mouthwash is a big no-no now. There's studies to show that we want to avoid these raw, really strong mouthwashes because they can wipe out the bacteria that produce nitric oxide. And as a result, you can, with chronic use, we're seeing high blood pressure, cardiovascular issues, um, vasodilation issues, so sexual health issues. That gets
Hmm.
people's attention usually.
Yeah.
So less is more. I mean, we should not
Yeah.
be carpet bombing the mouth.
Yeah.
We are coming out, I hope, of that. Like everything needs to be disinfected, bleach everything, and so much hand sanitizer, and
Yeah.
moving toward actually exposure is good. Get your kids in the dirt. You know, everything doesn't need to be sterile. We're not supposed to be
Yeah.
sterile beings in a sterile world. Um, and your mouth isn't supposed to be sterile either. And everything you're seeing on that bottle is marketing. They are taking advantage of you, and
Yeah.
running all the way to the bank. So I'm a very much less is more. People will always say, "Well, what should I use instead if I want to rinse?" I say water and baking soda.
Wow.
Baking soda will buffer the mouth. It's going to
Yeah.
neutralize or even make the mouth a little more alkaline. Maybe a little sprinkle of high quality salt.
Hmm.
Um, just because that will act as an antiseptic
Hmm.
essentially. And that's it. That's all you need. Now, if you have chronic bad breath, you have
Hmm.
something more going on.
Right.
Don't ignore that. We shouldn't have like dragon breath. So you could have something from the gut. It actually can be coming from the gut. It can
Yep.
be coming from the sinuses. Like maybe you have a chronic sinus infection, or maybe you have some sort of infection in your mouth. You have a failing root canal. You have a failing crown or a filling, or maybe you have gum disease or periodontal disease. And that you do not want to ignore these things.
Hmm.
So just as we said, like, get your child in early to prevent issues. I want everyone microbiome testing their mouth, because I'm in my 40s. You know, if I microbiome test and I see a bacteria, let's say F nucleatum, that has been linked to pancreatic cancer
Yeah.
and colon cancer. I might not see the symptoms of that, the signs and symptoms of that, till I'm in my 60s, 2 decades from
Right.
now. But if that showed up on my oral microbiome test, you'd be darn sure that I'm going to do things to eradicate that, or at least lower it into a normal threshold. So then I retest, yay, it's no longer in the red, it's in a normal range. So yeah, so that's bleaching. I think the most important thing is everyone know that all these things that you're doing, you have to do a risk benefit assessment. Like
Right.
what is the reward versus the risk?
Would you say that there's a parallel between how mouthwash, traditional mouthwash, just demolishes a lot of the good bacteria in our oral microbiome, kind of similarly to how antibiotics wreck our
Oh
guts in
yeah,
that same way?
exactly. Yes,
I think.
precisely. But also antibiotics are going to impact your oral microbiome too, because they're not
Mhm.
just targeting the gut microbiome. I mean, they'll influence every microbiome in the body. And that's why a lot of patients, now this might resonate with some listeners,
Mhm.
I get calls a lot that the child or even the adult goes on antibiotics and then they notice, what's all this staining on my teeth?
Wow.
Or their mouth feels different. It's drier. They just notice shifts in their mouth. It's
Yeah.
because they wiped out some of their healthy bacteria and they're seeing just shifts in the microbiome. Now, usually, if the host, the human, is healthy,
Mhm.
it and they're maybe doing prebiotics, probiotics, postbiotics. They're doing all the
Mhm.
things, fermented foods, trying to build back up their microbiome. It's hard and it takes a long time, but they'll see it shift back.
What should we be looking for in our toothpaste?
So this gets in the weeds a bit, but unfortunately, conventional toothpaste, and you guys know what the big brands are,
Mhm.
okay? They're no good. They are
Mm.
filled just like you think of food. I want you to start reading toothpaste labels like you would food labels,
Mhm.
okay? You're putting this in your mouth, you guys. Like,
Yeah.
what's in it? So, is there sodium lauryl sulfate, which is like a foaming agent? We're so used to that burn and that foam. We need to shift away from that. Just like many of us have moved away from shampoo
Mhm.
that like foams and strips, or and we're not washing our hair as much, or maybe we've moved towards a more natural deodorant. And there was a transition period, right? Maybe you smelled a little bit. It took a while. Why? Because your armpit microbiome had to readjust. So it's the same with your toothpaste. You really need to be moving away from these strong foaming, burning. So sodium lauryl sulfate, emulsifiers, surfactants, triclosan, really strong essential oils. I mean, we love essential oils, but they can be very antimicrobial. Some work as well, like oregano, as well as antibiotics in certain situations. If you're putting tea tree oil or really strong peppermint and spearmint extracts into your mouth every day, what is it doing to the microbiome? And it can be damaging healthy microbes too. So this is why a lot of people might have perpetual issues. You're stuck in this cycle because what you're putting in your mouth is actually making your symptoms continue or stay even worse. So we want to have ingredients in our toothpaste that we understand. What are they there for? We want transparency. With the subject of fluoride, this gets very controversial and heated quickly. So if you want to use fluoride, I suggest please only use it topically. I will be very vocal about I do not support systemic fluoride. We do not need to be ingesting it in any capacity. It's been shown in the data it works topically, not systemically. That is antiquated thinking, and there's so much research to support that. Even though the mainstream media is saying otherwise, I will fight to the death on this. Just kidding, not really, but I take it very seriously.
Yeah.
That being said, topical fluoride does work. It makes your enamel more acid resistant, which is great. So I think this is a personal choice. I'm cautious of it for many reasons, but one that tends to be less controversial is that it's antimicrobial. It's not selective. So what is it doing to your oral microbiome? This is the question I want everyone always thinking. What is it doing to my oral microbiome? And there are studies to show it kills healthy bacteria too. And this is a concern with ingesting it, like water fluoridation. You're drinking something antimicrobial multiple times a day. What is that doing to your gut microbiome? Is that creating intestinal permeability? Is that wiping out healthy bacteria in the gut? And the answer is yes, it absolutely is. And there's studies to show that too, which is why I don't want us ingesting it. So I do want people to be using ideally something that is data-driven, science-backed, that remineralizes. So my personal preference, what I've been using clinically for a decade, is hydroxyapatite.
Okay.
There's microhydroxyapatite. There's nanohydroxyapatite. I prefer nano. It's just the particle sizes are smaller and they fill in microporosities, and that is what you need if you're trying to arrest, remineralize, or reverse decay. There's all kinds of crazy stuff online about hydroxyapatite, of which I'd argue like it seems a majority is incorrect. I always look to science. So the SCCS is the Scientific Committee of Consumer Safety in the EU, which is very strict, very well respected and regarded, has approved nanohydroxyapatite and hydroxyapatite for oral healthcare products, as have the health ministries in Japan and South Korea. These are countries we look to for guidance with our guidelines, so I trust them very much. I mean it. I have not seen anything work as well clinically. When my patients shift off fluoride toothpaste onto a hydroxyapatite toothpaste, everything gets better. Their oral mucosa looks healthier. Their salivary health looks healthier. Their tongue looks healthier. Their teeth, they say they feel healthier. And some people you will read online blame shifting away from a fluoride toothpaste and their kids get cavities. Please be cautious listening to these stories. No one gets cavities from their toothpaste. There is something going on in that child, likely dietary, or how they're breathing, or their gut health, or they're vitamin D deficient. And I wish these parents would dig deeper and not blame a product on their issues, So anyway, so that's what I love. Theobromine is also, it's made from cacao or chocolate, essentially. That can remineralize beautifully. I love theobromine. Xylitol is essentially, it acts as a prebiotic, but it can influence remineralization. So those are some key ingredients to look for. But I just think if you're reading your toothpaste and it's just a lot of long chemical words, and it's probably something you should avoid.
What should parents be looking for with their children in breathing? What are some of the red flags or the signs that your child has airway issues?
It's one of the least controversial things, thank
Yeah.
goodness, that even dental schools are now implementing more and more, and the American Dental Association is recognizing it and
Yeah.
considering airway screening standard of care now, although many dentists still aren't doing it.
Yeah.
They really should be, because they're not following guidelines. But how you breathe is so important for your health. It's so
Mm,
important for your blood gas ratios. It's so important for um, your sleep stages. And do you
mm,
really get into deep restorative sleep? Are you Darth Vader breathing, grinding?
mm,
We need to think airways on a continuum. So many people just think of sleep apnea,
mm,
but there's open mouth, there's mouth breathing, there's sleep disordered breathing, there's this regulated breathing. It's on a continuum,
mhm,
and sleep apnea is end stage disease. Okay, we don't want to get there. Let's catch this stuff early, you guys.
mm,
So why do we worry about this? So from a dental standpoint, if a child comes in and the parent's doing what it does appear everything correctly, and the
mm,
kids still get cavities, there's a few things I think of. I would say, I wonder if they have vitamin D deficiency. I wonder if they're magnesium or mineral deficient. I wonder if they have mycotoxin exposure.
mm.
Um, so mold can
Yeah.
trash teeth, and that could be a whole other episode.
Yeah.
Um, I'm thinking of gut health and all that, but I'm also wondering, do they breathe through their mouth? So
Hmm.
when we breathe through our mouth, I just said, I want you worshiping your saliva. So when you breathe through your mouth dries out. That's why you wake up like kind of sticky, your breath smells. That shouldn't be the case if your lips are closed and sealed and your tongue is in the proper position, your nasal breathing all night. You should wake up pretty with a pretty good mouth, not too stinky or smelly, not too much sticky film. But if the minute you wake up, you like have to run and brush your teeth because you just feel gross and there's like a puddle on your pillow, you're a mouth breather, and ask
Mhm.
people to observe you and help you. But so you lose the integrity of your saliva, and that's called xerostomia, dry mouth.
Mm,
And that is the fastest way to just destroy teeth. And if you look at cancer patients, who are undergoing radiation, chemotherapy, usually that really impacts salivary health. They just get rampant decay.
hmm.
We see this in perimenopause and menopause, yay for us women, but we tend to lose our salivary health a little bit as we age, and we can get more issues, not to mention cortisol
Yeah.
impacts our salivary health as well. When you're in fight or flight, your body isn't thinking about making saliva. It's thinking
Hmm.
about running away from the saber-toothed tiger or whatever stressor you have that day. So dry mouth will lead to cavities. Dry and breathing through your mouth is going to shift the microbiome. So it's going to make your
Yep.
mouth more acidic, and acid is disease. So a low pH, pathogenic bacteria thrive. They want acidity. That's why I
Mm,
said rinse with baking soda, because pathogenic bacteria, they can't sustain themselves in that type of alkaline or even neutral environment. So if you're breathing through your mouth, you lose saliva, the pH drops, it creates this perfect environment for pathogenic bacteria, not to mention you've lost the protection of your saliva. And so we
mm,
can see cavities form very easily in mouth breathers. The other thing with kids, well, no, sorry, with everyone. So if you're not getting into deep restorative sleep, you're
mm,
not getting into the stages where the lymphatic system kicks in and we're doing brain cleansing and toxin elimination, but also a lot of hormones are released in these deeper stages of sleep. And with kids, what's important is growth hormone and
mm,
diuretic hormone too. And so these are things we talk about with parents. So growth hormone, a lot of these chronic mouth breathers, these children, they tend to be of low and of small stature.
mm,
Um, and also they can have prolonged bedwetting, not always, but so
mm.
these are hormonal issues. Now, also over the years of this chronic mouth breathing and snoring and tossing and turning and just not sleeping well, these kids are in a constant state of fight or flight, and they often get pegged with behavioral issues, ADHD, and they get put on meds, and really no one has done a proper airway sleep screening on them.
Mm-hmm.
And what if we did that? And what if we could get their airway under control? And what if their behavioral quote unquote issues are actually because these kids are just chronically exhausted and their nervous system is so dysregulated from waking up all night. Some of these kids are choking, that's where you hear breath holding and the
Yeah.
gasping, and they're moving around to reposition themselves so they can breathe. And because they feel like they're asphyxiating all night. Imagine what that's doing to their nervous system and
Yeah.
to their brain development.
Yeah.
Okay, they're not getting enough oxygen. So you get 20% less oxygen when you breathe through your mouth
Wow.
than when you breathe through your nose. And not to mention, your nose is so important also for nitric oxide production. It filters, it humidifies. So you're going to get sick more. The quality of the air that's coming into the body is not optimized. So it's so important. And so what am I looking for? I mean, the first thing I look for is I'm looking to see how a child walks into my office, sits in the chair. How are they? Is their mouth agape? Do they look kind of like Napoleon Dynamite? I want you to think about that. That's the forward head posture, the mouth open, the tongue's low in the mouth. That is not ideal. And then there's screening questionnaires that a forward-thinking airway-focused functional dentist should give in your patient intake packet. And these are just quick screeners, just to say, does your child grind? Do they snore? Do they breathe heavily? Do they toss and turn? Do they sleepwalk? Do they sleep talk? Do they have night terrors? Do they bedwet past an appropriate age? Do they have behavioral issues? Are their teachers starting to say, I'm worried about your child. They might have ADHD. They can't sit in their seat. They can't focus. You've seen mood disorders. Are they starting to get cavities? So this is a screening tool that we go through. And then we have to unpack it. And so what am I looking at? I'm looking at muscle tone. Like, can their lips even physically close together? I mean, you have to understand there's skeletal relationships too. How do the jaws fit together? How are the teeth? Are the teeth sticking straight out so the lips can't even close around the teeth? That's an issue. What is your muscle tone like? What is your tongue posture? Your tongue is a muscle. So low tone is important. And then what the jaws, like, do you have narrow jaws, a narrow palate? That means your tongue can't even fit in your skull. And so we are shrinking. The human skull is shrinking. People are interested in this airway stuff. There's 2 books I highly suggest you read. One is Breath by James Nestor, one of the best books ever written, in my opinion, ever, just on anything, but also on airway. He writes it as a nonfiction narrative. It is such a fun read.
Cool.
I want everyone reading it. It will change your life if you read this book. And you will never look at airway the same way. You will worship it as it should be worshiped. So read Breath by James Nestor, and then sleep. If you're a parent, Sleep Wrecked Kids. It's especially if you think James's book is going to be more truly educational.
Yeah.
And then Sleep Wrecked Kids is like boots on the ground. Like, my kids have an airway issue. There's no one in my area that's listening to me. I know something's wrong.
Yeah.
Sharon Moore wrote this for parents to help triage and diagnose their children, but she also goes into the science and stuff too. So Sleep Wrecked Kids. So yeah, I'm looking like, are they crowded? Are their jaws small? I'm looking at their eyes and under their eyes. Do they seem inflamed and stuffy and like chronic allergies? Can I tell, do they have like a little bit of a deviated septum? What do their tonsils look like? You can kind of tell by how a child's face looks if they probably have big adenoids too. There's something called the adenoid facies. And so allergies can be part of it. Micronutrient deficiencies can be part of it. Parasites. I mean, this is where we need to dig into all these other systems that traditional dentistry doesn't.
For adults, right, we've seen this kind of, I don't want to call it a fad, but it definitely is a trend that has popped up of wearing mouth tape, right? So this is like a whole thing. So the mouth tape, so now there's a bunch of influencers and other people talking about mouth tape and the importance and all of this stuff, which, maybe that works if you're a 30, 40-year-old woman, right? But what do we do for our kids if they're doing this?
Yeah.
So, and then also what is your, what do you do as an adult as well? Because there's probably a difference for both if you are mouth breathing.
So I'm a big fan of mouth tape. I mouth tape every night.
Okay.
It
Awesome.
absolutely works. My mouth just tends to pop open
Mm.
because of an alignment issue from an accident I had. Kids can mouth tape age 3 and above, but
Wow.
do not do it unless you are working with an airway trained dentist.
Yeah.
They will recommend it or not recommend it. They need to be screened and cleared. Now, the things with kids, you're only mouth taping them to get through a period until you can course correct, right? We need to work with a properly trained provider because otherwise it gets incredibly overwhelming and you need to peel back the layers. So the key is you have to make sure you can breathe through your nose. Some people
Mhm.
can't. Some people actually can't breathe through their nose. They have
Mhm.
deviated septum, enlarged turbinates. There's so much inflammation from allergies or some exposure. They actually physically can't breathe through their nose. So there is a test. It's called the lip seal test. You just want to be able to breathe through your nose for 3 or 4 minutes.
Mhm.
If you can do so without feeling panicked or sympathetic, like really upset, nervous, then you probably can lip tape. So, and this
Mm.
is the same with adults.
On the note of breathing during sleeping, and cortisol levels and regulation, a lot of people I think would be pretty surprised to hear that their cortisol and their stress levels are affecting their oral health and that there is a
Mhm.
relationship there. So if you could just kind of explain how cortisol and stress are impacting the oral health and vice versa, and how it's impacting the whole body, maybe draw some conclusions there that listeners might not have been aware of before this conversation.
Specifically, when your cortisol's elevated, your salivary health will salivary output will decrease. So you will
Mhm.
tend to have more dry mouth or xerostomia.
Mhm.
So that's important. So again, worship your saliva. So
Mhm.
that's one way, but also when we're stressed, we do tend to clench or
Yeah.
grind, or we just hold a lot of stress in our jaws, and that can translate into sleep. And so you wake
Mhm.
up with like jaw aches, but you also maybe have cracked teeth, and every time you go in the dentist there's wear or sensitivity or a filling fell out. You're probably clenching or grinding at night. So those are two of the easier explanations. But then of course too, if we're just dysregulated in general,
Yeah.
that's going to impact nutrient absorption. That's going to impact, sometimes it impacts our actual hygiene routine. We're just too
Mhm.
overwhelmed. Like this can be associated with depression too. Like you just don't want to pick up the toothbrush or the floss. So
Right.
um, blood sugar dysregulation is really important too. Like if your blood sugar is really high in your saliva, that's going to impact your microbiome and can lead to dental disease as well. And
Mhm.
so, are your hormones impacting things of that nature? And your thyroid health and all of it is so important. Um, and you can get in the weeds pretty quickly. I want to go back a little bit too with sleep.
Yeah.
Um, Sleep doctors will speak of some important nutrient deficiencies that it can impact sleep quality. And to I agree with you. There's so many variables. The blue
Mhm.
light, there's too much sensory overstimulation now, and
Mhm.
etc. But vitamin D deficiency,
Mhm.
magnesium deficiency, and iron deficiency all can impact sleep. So with a lot of these kids, especially if the parents just report a lot of tossing and turning,
Yeah.
I will say give them a magnesium blend before bed. Like not just citrate, not just the one everyone uses. Like it needs to be a high quality magnesium blend. See if that
Mhm.
helps. That will actually help your oral health too. Vitamin D3K2, I think most of us
Mhm.
should be on that. You have to test, don't guess. I want people outside. Of course, in a perfect
Yeah.
world, we'd be optimized from being outside, but I like to be a realist too, and I want people just to be healthy. So,
Yeah.
iron, I don't mess around with unless we know someone's iron deficient. So we have to
Yeah.
test. Um, but yeah, your stress is so important, and so,
Mhm.
and again, this could be a whole conversation. I lecture on this too, but
Yeah.
women's hormones, and so we have estrogen
Yeah.
receptors in our gums. So as we're going through perimenopause and menopause, a lot of women report their gum health changes, or they might report their teeth shift, or they
Yeah.
start getting joint issues. Well, progesterone impacts collagen. synthesis and how collagen is reacting in our bodies too. And so, our joints and the periodontal ligament around our teeth are impacted. And so imagine, and I'm happy to see this movement, we talked more about supporting women through these phases and maybe hormone replacement therapy and just staying ahead of it. And how would that benefit their oral health too? So there's just so much to unpack there, but
definitely do that.
the last thing I'll just say, this can be really overwhelming to people. They listen to this and they're like, wow, yes, I want this. But then they're like, there's nowhere to go. And so I hear you. And this is why we have created a solution. And so hang in there. We can put some resources in the show notes of some programs out there. They're not to my standard, of how I want the providers change. We're really trying to revolutionize dentistry and create a big shift. But just hang in there. There's people out here working to make a difference.
Just share practical, everyday routines that parents can start to do to protect their children's teeth and their children's microbiome.
Absolutely. So I'll start with food first. Food fix. So it's the most important thing. What are you feeding your kids and how often are you feeding them? And we didn't get too much into this, but you have to be eating on a schedule. Humans that snack and graze and do pantry drive-bys and sip on drinks, and even sparkling water is acidic, everyone. They tend to have more disease. So we have to be more regimented and on a schedule, and eat whole foods. Eat a rainbow is what I teach the kids. Feed your good guys. We talk about prebiotics and polyphenols, and I want to feed the good guys in my body more than the bad guys. Okay. I want to feed the good bacteria more than the bad. The good bacteria like fruits and veggies, meats, cheese, etc., nut seeds, etc. The bad guys, they like the chips and the crackers and the pretzels and the granola bars, etc. Okay. So food first. Definitely fermented foods too. Please start embracing a little bit of fermented food every day. Sauerkraut, naturally fermented pickles, kimchi, kefir, etc. That's really important. So start your kids young with that. I would then say hydration. Spit. Your spit needs to be healthy. Your spit should be like water. It shouldn't be thick and ropey and mucousy. If it is like that or bubbly, you're dehydrated. And minerals. We don't have enough minerals. So put minerals into your water or a sprinkle of high quality sea salt. So what you eat, hydration. I want everyone flossing. We talk so much about brushing. I wish it was shifted. I wish flossing was more focused upon and brushing was like, I'm not saying don't brush, but it's really important because most pathogenic bacteria are anaerobic and they like to live between the teeth. So it's not to remove food. We are disrupting the biofilm. You're removing the layer of bacteria on your teeth. Please don't forget in between your teeth. I guess I would also say be cautious with your products. I mean, just read labels and then get your airway under control. You have to focus on airway. And this is way, way, way beyond your oral microbiome. This is your whole body health. I think I can't think of anything more important than breath. And like, what can we not live without for 2 to 3 minutes? Right? There's only one thing, oxygen. So how you breathe. And none of us, we all have dysregulated breathing. We're breathing too shallow. We're breathing too fast. We have to get back into deep diaphragmatic, relaxing breathing. This is going to help your nervous system. It's so profoundly beneficial to your health. And this is why I want everyone reading Breath by James Nestor. It really will change your life.
So I've been using a toothpaste that you founded with a couple of other awesome people called Fig. I think you guys pronounce it Fig. Feed your good guys. Yes. And so that's an awesome brand. That's a great resource for everyone who's listening. Why don't you just tell everyone where they can find you, your work, what they should be following along with, obviously on social media, but if there's other websites or resources that you want to direct everyone's attention to.
Yeah. So I'm mostly on Instagram, Dr._Staci, and doctor spelled out DOCTOR_STACI. That same handle, you can find me on TikTok and X and LinkedIn, but I'm in Facebook, but I mostly spend my time on Instagram. Awesome. I do have a website, drstaci.com. I do a weekly newsletter where I really dig deep into a topic every week. And I like to think I give really important no cost, low cost tips, or like my favorite supplements or recipes, or just it's fun, and I've been getting good feedback on it. So you can go sign up for my newsletter. You will get a
Awesome.
cavity protocol guide. I have an office in Portland, Oregon. I am seeing new patients. It's called Bloom Kids Dentistry.
Cool.
Um, I do have the oral health care line, Feed Your Good Guys. That's a prebiotic microbiome supportive toothpaste that I really am obviously a fan of. I put a lot of love into it in the formulation. And then the Institute for Functional Dentistry is launching
Yep.
soon. So,
Cool.
I would follow along there. And pretty soon, after we have our first cohort of students graduate, there will be a list of providers, and we have
Yeah.
over 500 people on the wait list. So that's
That's awesome.
yeah, I'm pretty excited about it.
We
So
we talk internally about this kind of stuff a lot, my husband and I, and with physicians in the family and all this, but I think that the credentialing is, what you're doing, going all the way upstream to focusing on children and then focusing on the credentialing. That's the best use of time. I mean, that's where you'll have the most impact. So thank you though for your time and really appreciate it. We'll point everyone in your direction and look forward to this episode helping a lot of people and educating a lot of people. So thank you, Dr. Staci, and I can't wait to talk to you soon.
yes, thank you so much. I appreciate your time.
Hey everyone, thank you so much for tuning in to the Gut Check podcast. If you enjoyed this episode, leave us a comment below. Let us know what you think, like the episode, and share it with friends and family who may also benefit from learning about these important and educational health and wellness topics. You can find the Gut Check podcast on YouTube, also on Spotify, Instagram, and TikTok. The Gut Check podcast is brought to you by our team at Daily Nori. Daily Nori makes probiotic and prebiotic solutions accessible to all because good health starts with gut health. To learn more about Daily Nori, please go to www.dailynori.com. Thank you.